Good day, everyone. My name is Ray Christian Sepe. In this topic, or in this video, I will discuss about the role of physical therapy towards Bell's palsy. I am a current intern from Suleiman University Medical Center. So, Bell's palsy is characterized by an acute paralysis of a face due to inflammation and swelling of the facial nerve within the facial canal or at the stylomastoid foramen. Bell's palsy is a rapid unilateral facial paresis or paralysis of unknown cause. This condition is named after Sir Charles Bell, who was a Scottish surgeon, neurologist, and anatomist. It is the most common disorder of the facial nerve 7, and it's an acute lower motor neuron lesion associated with viral infection and facial nerve swelling within the facial canal, although its precise cause is still unknown. The condition leads to the partial or complete inability to voluntarily move face muscles on the affected side. Facial paresis or paralysis that occurs in Bell's palsy may cause significant temporary oral incompetence and inability to close the eyelid, leading to potential eye injury. For the relevant anatomy, the facial nerve is the seventh cranial nerve and is the nerve of facial expression. It has both motor and sensory functions in the body as well as parasympathetic control to the lacrimation, salivary, and pharyngeal mucous glands. For the motor part, it innervates the muscles for facial expression, posterior belly of the gastric and styloid stapedius muscles. For the sensory, it innervates a small part of the concha of the auricle. For the sympathetic function, it supplies the submandibular and sublingual salivary glands, nasal, and lacrimal glands. For the epidemiology, Bell's palsy is approximately 60 to 75% of such cases. Right side is more affected, then bilateral facial palsy can also occur with occurrence of at least less than 1%. And this condition is more characteristics of for winter season, largely because lower temperatures are associated with overall high risk. The condition is more frequently in younger women, aged 10 to 19, compared to same age as men. So pregnancy can increase the risk threefold, and in pregnant women, Bell's palsy most commonly appears in the third trimester. Preeclampsia is also shown to increase the risk. It's more common in adult than peak ages of 20 to 40 years of age, and older than 65 years of age somewhat have higher prevalence. Uh, for the etiology, the exact cause is still unknown. Usually it happens after trauma, pressure upon the facial nerve due to tumor, and three categories regarding the cause. First, hereditary. Second, vascular ischemic theory, which is the exposure of cold, and viral theory. It is affected by virus. The clinical manifestation. Some patients also report general malaise in the few days of onset, some pain in the ipsilateral mastoid, but many patients have no otalgia or malaise. Uh, some uh, some symptoms appear, such as synkinesia, which is the simultaneous movement, the crocodile tears, which is the shedding of tears while eating, drinking, or smelling food, facial contractures, which exhibits a shortening of facial muscles over time on the affected region, then lagophthalmos, which is inability to close eyes, and the Bell's phenomenon, which wherein the kanang movement of eyeballs in an upward direction when the eyelids are forcefully closed. For the assessment of for physical therapy, we use functional muscle testing, wherein we'll assess the muscle grade of the muscles of the face involved for expression, then sensory testing, testing the kanang taste buds on the tongue, then special tests. Special tests which includes the Bell's phenomenon, marine ammon phenomenon, and Marcus Gun phenomenon. For the Bell's phenomenon, when the eyes is forcefully closed, the eyeballs roll upward. For the marine ammon phenomenon, uh, involves a synkinesis to one eyelids upon fully opening the jaw or movement of the jaw laterally. For the marine gun phenomenon, when the upper eyelid falls to cover the eye with movement of mastication. For the prognosis, incomplete paralysis in the first week, most favorable sign. Improvement is usually seen within 2 to 3 days. Most cases will begin to show signs of improvement within 3 weeks. Recurrence rate of 10%. Then people who have family history of Bell's palsy are more likely to suffer recurrence of the condition or salivation. So this is the classification of Bell's phenomenon according to its severity. It is graded by House-Brackman classification of facial function, which starts with grade 1, then grade 1 to 5. For the medical management, eye patch or sunglasses are used to protect eyes to prevent scratching of cornea from dust or fingers. Artificial tears are used in daytime. Moisture chamber is used at nighttime. Bland ointment is applied during bedtime. Plastic wrap over the eye, fixated with a hairnet tape, is used to keep the eye moist. Consult an ophthalmologist if the patient complains of eye discomfort or if the eye looks irritated even with usual care. For the oral care, we have oral steroids, analgesics for relief of pain, antiviral agents, and prednisone. This is used to prevent denervation, autonomic synkinesia, and progression of the palsy to paralysis and shortens the course of the weakness. So for the physical therapy management towards treatment of persons with Bell's palsy. So during acute or in subacute stage, splinting for the paralyzed muscle to relieve the strain and preserve tone for cosmesis, facial massage for 5 minutes twice a day in a chin to forehead direction to maintain the tone. Use of eye patches, goggles, or sunglasses to protect cornea from damage and irritation. Infrared lamp to increase blood circulation. Uh, and ES application, electrical stimulator, to stimulate the muscles and nerve using a motor point, following the motor point pattern for Bell's palsy treatment. Then HMP to hasten recovery and for relief of pain. During paralysis, ultrasound is used over the nerve trunk. Massage is taught to the patient to kind of relax the paralyzed muscle, which is followed by the upward and outward stroke. And patient education and advice should be done at intervals to reduce the effects of gravity upon paralyzed muscle. Eyes should be blinked gradually because of blink reflex is lost. For other patients, we have a home exercise program to recommend, which is the use or the chewing of gum and the using of straw when drinking fluids or water to help control the muscle of the vaccinator and such. So that's all. Thank you.